Fatty fish like salmon, mackerel, sardines, and anchovies are among the most powerful natural allies in the fight against high cholesterol and cardiovascular disease. Unlike red meat, which is high in saturated fat and linked to elevated LDL cholesterol, fatty fish are rich in omega-3 fatty acids, especially EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, which have been shown to lower triglyceride levels, reduce inflammation, and support overall heart health. For individuals dealing with dyslipidemia or elevated cardiovascular risk, incorporating fatty fish into the diet 2 to 3 times per week can offer protective benefits that are both clinically proven and nutritionally sound. One of the primary actions of omega-3s is their ability to reduce triglycerides, a type of fat in the blood that, when elevated, significantly raises the risk of heart attack and stroke. High triglyceride levels often accompany high LDL, bad cholesterol, and low HDL, good cholesterol, an especially dangerous combination. By decreasing liver production of triglycerides and promoting their clearance from the blood, omega-3s help correct this imbalance. Furthermore, they may slightly raise HDL cholesterol in some individuals, offering additional cardiovascular protection. Omega-3s also play a powerful anti-inflammatory role, reducing the chronic, low-grade inflammation that contributes to atherosclerosis, the buildup of plaque in the arteries that can lead to heart attacks. They help stabilize heart rhythm, reduce blood clotting tendencies, and improve endothelial function, making blood vessels more flexible and less prone to injury. These mechanisms explain why diets high in fatty fish are consistently associated with lower rates of sudden cardiac death and cardiovascular events in large population studies. However, not all fish are equal. Fatty, cold water species like salmon, mackerel, herring, sardines, and anchovies offer the highest levels of omega-3s and the greatest cardiovascular benefits. In contrast, lean fish like cod, tilapia, or catfish contain far less omega-3 and should not be considered substitutes in this context. Farmed salmon and certain other commercially raised fish may also contain lower levels of omega-3 and higher levels of contaminants, so sourcing and quality matter. Wild-caught, sustainably sourced options are generally preferable. Despite these benefits, there are important cautions. While omega-3 rich fish lower triglycerides, they do not significantly reduce LDL cholesterol, and in some cases, may even slightly increase it. This makes fatty fish a helpful but incomplete tool for cholesterol management. They must be combined with other dietary strategies, such as increasing fiber intake and reducing saturated fat. Additionally, fish should not be fried or breaded, as doing so introduces trans fats and oxidized oils that negate many of the heart protective effects. Baking, grilling, or steaming are far better cooking methods for preserving omega-3 content and maintaining nutritional value. There is also growing concern about heavy metals and pollutants in some fish species, particularly large predators like swordfish, king mackerel, and shark. These fish accumulate mercury and other toxins, which can pose health risks if consumed frequently, especially for pregnant women and children. Thankfully, the smaller fatty fish, like sardines and anchovies, not only provide high levels of omega-3s, but also have much lower mercury levels due to their short lifespan and position low on the food chain. Fish oil supplements can provide concentrated doses of omega-3s, but they are not a perfect replacement for whole fish. While some prescription-grade omega-3 formulations are effective for lowering very high triglycerides, over-the-counter supplements vary widely in quality and may not deliver consistent benefits. Moreover, relying on supplements instead of food may forego other important nutrients present in fish, such as selenium, vitamin D, and high-quality protein. In conclusion, fatty fish are a valuable, evidence-based food choice for people managing high cholesterol and heart disease risk. Their omega-3 content provides significant support in lowering triglycerides, calming inflammation, and enhancing overall cardiovascular resilience. But these benefits depend on choosing the right species, avoiding harmful preparation methods, and integrating them into a broader, heart-healthy diet. When used wisely, fatty fish are not just a safe option. They're one of the most effective natural therapies available for supporting cholesterol control and long-term heart health.